Today's guest is a well-known and honored member of the medical community. With everything going on in medicine, I thought this is going to be a really good time to talk to a prominent surgeon, a published author. He has a master's degree in public health and currently serves as a clinical professor of surgery at the Icahn School of Medicine here in New York. I want to welcome Dr. Jeffrey Fried to the Miller Report. Thank you so much. Can I call you Jeff?
Please.
Jeff, there is so much going on, and I just want to have a frank conversation with you about what you think and where we're going, where we're headed. You've been a physician for over 4 decades.
Correct.
And you are a prominent surgeon. I think you're on the board of Mount Sinai. You've been on the board, and you certainly know what's going on. So let's just talk firstly about the affordability of healthcare. We'll start with that because there's so many people that can't afford healthcare, and where the government should be and what your thoughts are on that.
Let me preface this by thanking you for inviting me.
Okay.
That's very kind of you. Secondly, I usually start off my lectures with a joke, but there's nothing funny about the topics we're going to talk about. These are very serious issues which are really affecting the quality of life in our country. And the cost of healthcare is certainly way up on the list of things that are affecting people. One of the major reasons that people file for bankruptcy is healthcare costs.
Wow.
And that is life-changing, obviously. In 1990, we spent $660 billion a year for healthcare. Presently, we're spending $4.7 trillion for healthcare, and the estimate's that in the next 5 or 6 years, that's going to go up by another $1 trillion. Every dollar we spend for healthcare, of course, are dollars we can't spend for something else. We can't build roads, we can't improve our schools, we can't prevent crime. So this increase in cost is not only significant, but it's changing people's lives and the quality of life in our country.
Why is there such an increase?
Well, half the cost of the increase, the differential, the increased cost per year, is due to the fact that we're getting older, we're getting more people that require health care, we have more uninsured coming in across our borders. These things have all increased the cost of health care. But the other half of the cost are new technology. And unlike some European countries, which when they approve a new drug or a new device, look at whether the device is actually necessary, whether the drug really adds anything to people's lives. And I'll give you a quick example. About 7 or 8 years ago, when the FDA approved the drug for colon cancer that has already spread and people essentially were dying. The drug in their studies increased life expectancy by about 6 weeks. The cost of the drug was $110,000.
And insurance companies paid for that?
Correct. The FDA approved it and the insurance companies paid for it. We didn't ask whether we should be putting our dollars to 6 weeks of life. And every day is valuable. I'm a doctor, and we fight to keep people alive every day. But if it's going to take away from a child getting the vaccination that they need, if it's going to take away from somebody getting the end-of-life care that they should, we have to really think about how to spend these dollars.
You know, it's interesting you say that because I hear so many stories of people saying, I have rheumatoid arthritis, I have this, and the insurance companies will not pay. So how do they choose what they're going to pay for and what they're not?
That is one of the great mysteries in medicine, how insurance companies actually say yes or no to any specific treatment or care.
Is politics involved?
Money's involved. And where money's involved, politics are involved because the insurance companies are regulated and they're given a certain latitude about what they can and cannot do.
Let's move on to the hot topic, which is vaccines. I mean, we've got measles, we've got somebody running the department that's not an MD. Tell us your thoughts on this, and let's go global on that one.
Okay, so vaccinations began in 1796 when Jenner in England discovered a smallpox vaccine. He recognized that children who had been exposed to smallpox but didn't get deathly ill were then immune. And he ultimately came up with the smallpox vaccine, which has saved millions of lives in the world and in many places eradicated smallpox. We know that vaccines have a place in medicine and healthcare. They change people's lives. They keep people alive. Vaccines should be tested like everything else. We ran through the mRNA vaccines for COVID without actually doing the clinical testing we would normally do on a vaccine.
We're going to get into that one.
That there's no argument about. And everything that the FDA approves, even for an emergency use, should have some testing. They should follow it.
What do you mean no argument in that? You don't think the COVID vaccine should have been?
Well, we had a healthcare emergency in this country, and they pushed it through under an emergency statute that the FDA has the right to do because of the need. But the vaccine's never actually been tested the way a normal vaccine would have been tested to approve it to be on the market.
Do you think they're effective?
Well, we're still fighting to figure out how to get the right combination in that vaccine to actually prevent this virus from attacking people. The virus mutates faster than we can make vaccines is one of the problems. The fact that remains the same is that we had the same number of deaths in 2021 as we had in 2020. This was in spite of the vaccine. And we're still trying to unravel why that happened. We had the largest number of deaths in the world of any developed country from
With
COVID.
the vaccine?
With the vaccine.
And the side effects of the vaccine, what about that?
And the side effects of the vaccine were real, and there are papers coming out right now in credible journals that the vaccine did cause a syndrome similar to long COVID in many people. And
Thank you so much, Dr. Freed. Most people will not speak out about that. I myself had the vaccine, and then I got COVID, and then I got really sick.
Right.
So people think it's their imagination. They think it's long COVID, and there's something to this.
No, there is now literature, incredible literature, that says that this is a real phenomenon.
Do you believe that the local schools should require a vaccine before somebody's enrolled? Like measles, mumps, tuberculosis. What is your thoughts on that?
So we demand that our children go to school, all right? And then with that demand, there's a responsibility to make sure that the environment is safe and protected. I think vaccines are part of that story. We have established vaccines that have been around for decades that we know prevent polio, for instance. I mean, we essentially have eradicated polio from the world, except in places that now have fallen down on their job, like Pakistan, which there's a large proportion of the population that don't want to vaccinate their kids. So polio is back. We know that there are vaccines that work, and the kids should have them, not only to protect that child, but protect other people's children and adults who are older, whose immunity has waned over the years and they haven't received boosters. I mean, as you get older, your immunity dies. Right? You live on, but your ability to fight those viruses decreases. So it's now been recommended that anybody over 65 have the measles booster because they feel that with the epidemic, and it's now turning into an epidemic in Texas as far as measles are concerned, that older adults will now be seen getting the measles infection because their immunity is waning.
So what you're saying is that as long as a vaccine has been tested, they should be required to go in the schools?
Absolutely.
And what about RFK and this measles epidemic? Do you think that he's made a mistake by not requiring people to have this? And where are we on that?
I'll give you one example. In New York in 1947, we had an outbreak of smallpox, of all things. In 6 weeks, we inoculated 6.5 million people. We had the political will, the science, and the finances to be able to do that, and we saved the city. A smallpox epidemic would have been catastrophic and would have spread if we didn't shut it down right then and there. I think if you see an epidemic and you have an effective treatment, that you should demand everybody be vaccinated.
And that's not happening?
Apparently not.
Okay. And what do you think about the fact that he doesn't even have a medical degree? I mean, is this one of the reasons he's not mandating these things and making it an emergency?
Well, you don't have to have appendicitis to know how to diagnose it and treat it. Secretary Kennedy has access to the brightest minds in the world at the NIH and the CDC. I mean, these people know about epidemics. They know about viral disease. They know about transmission of disease. They know about public health. You have to access these people and listen to them to be able to function properly. If you don't listen to the people who know, you're never going to do the right thing.
How do you think the CDC handled the pandemic?
Poorly. The pandemic was a national emergency, right? There's no doubt about it. I mean, it spread across the entire planet in weeks. I mean, we saw it go east and west. Shutting down flights from China didn't solve the problem. In New York, our viruses came from Italy and Europe. So you really had to shut the country down for 6 weeks, 8 weeks. One, to suppress the virus, but more importantly, to get your public health and medical efforts in place, to get your equipment that you would have needed, get the experts' opinion, get panels set up. Right? This was not a state-to-state issue. This was a national emergency that had to be handled at the federal level. There were things that have to be handled like that. We have experience. We have the flu epidemic of 1918, 1919, which killed hundreds of thousands of people because we didn't follow the rules.
But how would you explain that Florida did better than New York and they didn't shut anything down?
We're still looking at that. Clearly, we were slow to close, we were slow to mobilize our resources, and we were slow to reopen. We didn't handle this, as everybody kept saying, follow the science. We didn't follow the science.
What do you think? How do you think Fauci handled this?
Dr. Fauci is a very intelligent man who gave a large part of his life to this country. He made some mistakes. That I can say.
So while we're talking politics, can I pick your brain about a hot topic now about our possible future mayor, Andrew Cuomo? Do you think is he getting a bad rap, or did this really happen? What are your thoughts on that?
I mean, the facts are there. In March of 2021, the governor at that time, Mr. Cuomo, gave an order that nursing home patients in hospitals with COVID could return to their nursing homes. He later said that he was following the CDC guidelines. 6 weeks later, he rescinded that order because of the inordinate number of deaths in nursing homes from putting patients with COVID in those nursing homes and spreading the disease. CDC guidelines were not what the governor said. CDC guidelines very clearly said that if you're going to send a patient to a nursing home, you really had to be able to isolate them, get your staff to wear the equipment necessary, the personal protective gear that was necessary to take care of them, that you had to have all the guidelines in place before you could send a patient back to a nursing home. They did not follow those rules. After this catastrophe and all these deaths, his staff tried to suppress the number of people who actually died, and that was a terrible mistake. All he really had to say was, I made a mistake. That would have been sufficient. I mean, it was terrible what happened to those poor people, but it was a mistake.
I don't think anybody really knew. It was all treading water. The president, nobody really knew what was going on. It was just all at us. So,
but you err on the side of caution. You can't be cavalier in a situation that you don't understand. And we were very cavalier about that. And those were the people who were actually most likely to die. The old, the sick, the obese, multiple comorbidities. Those patients he sent back were actually most likely to die.
So why didn't the patients go on that ship that the president sent?
We physicians made a lot of mistakes.
So everybody made a mistake.
Because we didn't know.
Right.
But there wasn't a central agency gathering the information and changing the guidelines as more and more information came in. That was the problem. Nobody was with real knowledge of how to handle an epidemic was running the show. You really needed somebody with that kind of experience. And we have those people at CDC and NIH. We didn't utilize our resources.
You just said that Fauci, who was part of CDC, a prominent physician, didn't handle it right.
I think politics played a role in some of the decisions that were made. When you decentralize the effort to deal with COVID, I think you really made a tremendous public health mistake and really cost us lives.
Let's move on. I think everybody made mistakes, and I think everybody did the best they could in that situation, given where we were, and this all came at us, and it was just so fast and furious, and nobody knew.
I can only hope we learn something.
Because the next pandemic will come.
Will come. It's an airplane right away.
Wow.
That's all it is. From wherever it's going to come from.
The current administration is on this cost-cutting campaign. They're cutting so much. They're cutting. The biggest cost cutting is Medicaid and Medicare. What are your thoughts, and do you think the government insurance programs are cost-effective with Medicare and Medicaid, and is there an alternative?
When the entitlement acts were passed in 1965.
God, this guy's filled with information. You must read a lot.
I read a lot. When the acts were passed in 1965, Medicaid was an afterthought. It wasn't even a real program that anybody had thought out. But they said, well, there are poor people too. We really have to have some kind of an insurance safety net. This was only supposed to be a safety net. It wasn't supposed to be a full-blown program that paid for everything that Medicare didn't. And which it has turned out to be. So instead of being a small percentage of the Medicare cost for Medicaid, it turns out we spend as much money for Medicaid as we do for Medicare. All right. I don't think, in fact, I know that was not the original plan. And that's why Medicare and Medicaid now take up 37% of all our health care dollars, which is, we're talking about $1.5 trillion. Which is a significant, and going up at a rapid rate, probably another $1 trillion in the next decade.
Do you think these programs help or hurt the profitability of the hospitals?
Well, that's an interesting word that you use, profitability.
Is there none?
Well, so our healthcare system throws off a minimum of about $150 billion of profit. We're not the only country in the world that there's for-profit insurance. There are many, many, mostly developed countries that have for-profit insurance. However, we're the only country that throws off that kind of money, that there's an incentive to be in the healthcare business, because there's a lot of money to be made in the healthcare business. That profit is taking dollars out of direct patient care. That's the only place you can get it. If you're not...
Can you say that again?
Yes. If I have $1 worth of profit, that means a patient who paid a premium didn't get that full dollar that they paid. It went into the coffers of now investment banks, of insurance companies, of healthcare systems.
The CEOs of these companies, the administrators.
All of the above. And
so the patient's not getting the care, the money's going to administration.
Right. And now we have this new phenomenon of investment bankers buying healthcare facilities, medical groups, and their goal is to make more profit.
So they get the money.
Right. So this may be the American way, but it may not be the best way for Americans.
So the hospitals, are they making money right now?
Hospitals are screaming that they're dying. They're under tremendous pressure. Medicare has just cut their reimbursement. Again, the hospital systems have depended on Medicare and Medicaid to run their facilities. I mean, they've been licking this lollipop for decades now, and depending on that, without actually looking at the way they're running their hospital, the cost effectiveness and the quality of healthcare they're supposed to be providing. It's only now that systems are starting to look at how am I spending my dollars and how can I make it better. To go back in 1990, 100% of people liked their doctors. Everybody thought that in health insurance was...
Who doesn't like their doctor? They save your life.
Well,
At the end of the day, we all need doctors.
everybody liked their doctors in 1990, but everybody thought their insurance was too high. Now it's much higher, right? Only 3 out of 4 people like their doctors now.
Terrible.
We're losing our place.
Terrible.
All right, and health insurance is even more expensive. So is the public really getting what they're paying for?
So if you were our governor, do you have an option? Do you have an alternative for Medicaid or Medicare?
Well, the public, when Hillary Clinton started down this road in the early 90s, she wanted to look at how we were spending our money. And people got crazy about death committees and all the other things. You wouldn't be able to see a doctor and all that. But it's really not true. We have to spend our money effectively. We spend 1/4 of all Medicare dollars in the last year of a patient's life. We spend 1/4 of our Medicare dollars for people to die. We have to look at this. You know, are we doing things that are appropriate in that setting? I wouldn't deny anybody
Hard
anything.
truth.
I'm a doctor. I want
Hard
people
truth.
to live, but there are people who are not going to live. Wow. That's a whole other conversation.
I want to just lighten it up. Well, it's not lightening it up, but I want to move from medicine for a minute, and I want to ask your opinion because you have been a native New Yorker and you have all these advanced degrees. What about the Board of Education? Do you think that we should be dismantling this? What's your thoughts on that?
All right. So the Department of Education of our country has been a black hole since its inception. Its mission was to improve education in this country. To the best of what I can read about the statistics, we have not improved the education system in our country. Our kids aren't any smarter now than they were 3 decades ago. And we've spent hundreds of billions of dollars, not billions, hundreds of billions of dollars in this effort. Our children graduating from high school cannot get a job that could support themselves. Many of them can't add a column of numbers.
But now
Still.
these teachers are not going to have jobs.
No, it's the opposite. I want the teaching job to be a more credible job. I want us to hire better people.
But he's dismantling it.
Well, we're not sure what the Department of Education did, so we don't know what the effect is going to be of doing away with this. The plan is, from the President administration, to hand over the responsibility to the states. I've already said how I feel about disjointed plans. I mean, different states will do different things, not necessarily all at the same level. Educating our children should be one of our major functions in this country. I mean, we have 50% of college graduates can't get a job. They go back and live with their parents. This is not effective education.
Let's switch back to medicine. I mean, we're not going to solve the Department of Education. I just kind of threw that at you because I think that you're so smart. But back to medicine and politics. Do you think that foreign governments are actually supporting these hospitals? And is it true that there's a tremendous amount of financial donations that are being given to these hospitals from other countries?
Hospitals and universities are taking money from foreign sources.
Which foreign sources?
Mostly in the Middle East, mostly oil money. And I hate to say this, a lot of them are selling their principles for cash.
What does that mean?
It means that we can support, as a country, negativity throughout the world and maintain our position as the torch of freedom and equality and justice by supporting radical views and calls for death and calls for Holocaust against peoples.
So are you saying that the money given to these hospitals is foreign money, and that is affecting the ability for doctors to effectively treat patients, or for the hospitals to, I mean, how does that double down that it's going to hurt the end user, the patient? Or is it just a cost savings thing?
Oh, that's hard. Nothing's for free. We know that. If you affiliate yourself with somebody, if you put out your hand and take $1, there's a price for that dollar. That dollar's not free.
So how does that affect the hospitals? Foreign donations, how does that hurt or help I heard that a prestigious university like Cornell Medical School has campuses in Qatar, and they're making money from Qatarian funds. How does that help or hurt the hospitals?
It really depends on what resources they're allocating for this foreign effort. If you're taking away from our own people and giving it to somebody else, that's not a transaction that I would personally want to be involved with. Right? Our people should come first.
Are we getting less medical care and less prestigious physicians here because the money's coming from other foreign places?
It is yet to be written exactly what the price these hospitals are paying. I mean, we know what price the universities are paying. I mean, they're allowing behavior on their campuses that 50 years ago they would have never allowed. We cannot let foreign entities make decisions about our children's futures. That's for sure.
We're training them. We're teaching them. If you have campuses in foreign countries and they're coming to our schools and then they go there, are they coming to our schools? Are they being trained in American medical schools and then they have campuses there, or are they being trained there?
We certainly, a large part of our research, our graduate students, are being funded from abroad. They come, they learn, they leave. They're taking our intellectual property with them, especially China, which has used that technique in multiple universities to get access to information they would have never been able to get access to had they not funded these graduate students. The universities see this as wonderful. I mean, somebody's paying for my graduate student, but the price we're paying as a country is very high.
Well, speaking of schools, what's going on in Columbia? So my daughter, I think I said this on the air before. She works at Columbia, and she just told me that the head researcher of Alzheimer's was terminated, and he's posting a job requirement. He's looking for a job on LinkedIn. I mean, they're firing so many people, yet they're given money. So it could take us through that.
If Columbia's firing these people because of money, shame on them.
Well, they have restricted funds. What are they going to do?
Columbia has a $15 billion endowment. They have $15 billion in the bank, right? If they have a top-notch researcher who's going to change healthcare and change the quality of people's lives, and they fire them because they can't afford their salary, shame on them.
Who pays for a resident's salary? Is it coming from the federal government, or is it paying from the hospital?
Federal government.
So you're going to get less residents, correct?
If they decrease this, yes.
So the whole healthcare system is going to fall apart, basically. If the federal government, I want to retract that. I mean, Columbia or any of these schools that are going to not get money from the federal government now will not get these residents, and it's going to affect the quality of care in these hospitals, correct?
Well, so this is a very complex problem. You made it a little bit simpler. The average medical student graduates with about $150,000 worth of debt.
Right.
They may graduate with as much as $500,000 worth of debt. That debt is negatively affecting people going into medicine, especially minorities. All right, that debt is onerous, and for a lot of people, they look at that debt and say, "I can't be a doctor because I'll never be able to pay the money back."
With the salaries they're getting,
we really have to look. If we want the best people to become doctors, we have to find a way to support them through their training. I mean, I think it really goes all the way back to what do we want as a country? You know, what do we want at the end of the day? At the end of the day, we should want the best possible people in the most difficult roles at the end of the day. I mean, you mentioned politics. It shouldn't cost $1 billion to run for president. I mean, you limit the number of people who are candidates if you need $1 billion to run for president.
Let's stay on Columbia, because this is something that I mean, so the government has cut $400 million from Columbia, and now they're screaming that they're going to fire people, and there's even rumors that they want to close. I mean, is there any of this true? And do you agree with this?
Very few businesses close with $15 billion on the bank.
So you think it's just
they're
scare
leveraging.
tactic?
Yeah, they're leveraging now. This is smoke and mirrors. Shame on them.
Wow.
Shame on them. I mean, for even saying that. This is a prestigious university with very smart people who have allowed themselves to be used, in my opinion. And once upon a time, this would have never been allowed to happen. It's only in this new world we're living in where students are able to be terrorized by people on campus and not allowed to go to class. That this is a new phenomenon.
So you agree that the federal government should stop funding any institution that's spewing hate?
Well, it's a slippery slope. You have to be careful. I mean, hate speech, the Supreme Court has said, is completely acceptable. When you advocate violence in your hate speech, that is unacceptable. And a university accepting the students being terrorized is really breaking the law. The Supreme Court made it very clear.
Well, some Jewish advocacy groups, including J Street in Washington, acknowledges the issues at Columbia, but feel that the funding cut was an attack on free speech. So that's really what you're agreeing with. You're saying as long as it doesn't go to violence, free speech is okay.
The Supreme Court said that. I didn't say that.
Well,
and
these
I
cuts
agree.
are going to be challenged,
It's
obviously.
It's a slippery slope once you start limiting speech.
So what do you think the response should be?
Well, when I went to school, let me preface this by saying there has always been anti-Semitism on campus. You can't go to school without facing some anti-Semitism at some point. I mean, it's there, and it's going to be there, and we've never figured out how to get rid of it. But we used to solve the problem with our fists and pillows. Now there's these terror attacks and really physically preventing people from attending class. A university that allows that should be closed because that university is not supporting their own mission statement, which is to be sure that the students have a safe and continued environment to obtain their education that they're paying for.
Let's look into the future. Do you ever see a day where America can have less medical costs and have more of a preventive system? Something like RFK is trying to do. I mean, the East versus Western medicine. I mean, what are your thoughts on that being a clinical physician?
Our biggest enemy today is obesity. Obesity leads to all our major diseases.
But you have Ozempic.
Well, Ozempic is tremendously expensive.
There you go. Who pays for it?
Well, right now, if you're a Medicaid patient, you pay for it, and I pay for it. But what we lack is we have an uneducated, really health illiterate public who doesn't understand the value of health. Right? You're never going to make people's health better until they understand that it's in their best interest and accept that. And if I can buy beer and potato chips with my food stamps, it's never going to be okay. I mean, and
Wow.
You're going to get letters on that one.
Wow, this is going to be a big podcast.
You're going to get letters on that one. But the truth is, we have to encourage
You're going to
health.
tell people what to use, what foods to buy.
No,
maybe.
I'm going to tell them what they can't buy because it's bad for them. I wouldn't let them.
We're going to treat them like children.
I wouldn't let you buy rat poison and put it in your kid's food, right?
With your money.
I don't care with anybody's
Well, you're
money.
saying food stamps, the
With
government
food
money.
stamp- with our tax money, why would I let you buy things that are winding up being poison that are going to cause cancer and heart disease and stroke? I mean, that's what we're not thinking about. I mean, we're politically correct. We want everybody to have everything they want. But the reality, at the end of the day, they wind up at 55 with a heart attack. People who don't follow some kind of dietary regimen that's related to health wind up not living as long. Is that okay? Is that what
Well,
you
maybe
want?
Big Pharma likes this.
So Big Pharma is a whole other issue. They're in the business of making money. As I said before, we have to look carefully at the drugs that they put on the market. They should make a profit. They've made the effort. But if I give them money to develop a drug, right, my tax money goes to them to help them develop a drug. I don't want to pay for that twice. I already paid for it once. All right, so we have to start looking at how our dollars are used and how they're abused.
Thank you for being so candid.
Wow.
Let's talk about the medical school enrollment. How are they doing?
People still want to be doctors.
Why? They're not making money and they got loans.
So if you ask residents halfway through their residency, do they think they made a good decision? 40% of them will tell you no, that they don't think they made a good decision.
If you were going to medical school today and you were a young person, what would you tell yourself?
So not to be Pollyannish, but I love medicine. I've had a wonderful career. I've been all over the world practicing in countries.
And you have foundations I want you to
I have
talk
a
about.
foundation that supports international humanitarian work. We've worked in Ghana and Bolivia and all.
This guy does this for free. He goes on missions and operates on undeserved people. How many people have you saved?
Thousands.
Thousands. They've done a movie on you.
Yes.
We should start this podcast by talking about this. It's just fantastic.
I mean, so medicine's been very good to me. And I've fortunately never had a boss. I've always worked for myself. In spite of the fact that I've been in the medical community and in medical education, I've always had me as the person making the decisions. Right now, these young people are in a corporate environment. And they're forced... Hedge funds, even the universities, because of the financial pressure they're under, are forcing doctors to see 6 patients an hour and 8 patients an hour. I mean, you no longer have the opportunity, which I have had in my practice, to sit down and talk to people and find out who they are and develop relationships that have lasted years and years.
Because it's money, it's not medicine.
Right. This is the fun part of medicine, is the people. You know, ultimately, the machines are going to be doing all the work, but you are still going to make the relationship work.
And if you don't see the future that way.
Not if we go down the road that we're going down. No.
So to answer the question, would you go back to medical school if you were starting now? Knowing what you know?
I would advise any young person today, if they thought that they really wanted to have a life of service, all right, and love the idea of helping people.
Not money.
And not money.
Well, you should never go into medicine for money, but that's...
You know, that's an old story.
Yeah.
But if you really want to work hard and really do some good, and you have the thick skin to avoid the aggravation and this burnout phenomenon that I hear all the time now, I think there's no greater thing you can do on the planet than being a physician.
But medicine is politics. If we wrap this up, really this whole show has been talking about medicine has become politics.
Politics and money.
Politics and money. And not really, the doctors are not really getting the benefit. They're not making the money. They're getting a bad rap. The patients are not liking their doctors. You said 3 out of 4 patients don't even like their doctors.
No, 3 out of 4 still liked it.
Oh, still like the doctors. Oh, correction. And can I ask you a last question?
Yes, my dear.
Are you a New York resident?
I am.
Can you vote here?
I can.
Can I ask who you're supporting as a physician and as a resident?
All right, so the one thing that New York's lacked for the last 3 administrations, 2 of Mayor de Blasio and 1 of Mr. Adams, a leadership. Perception is very important in this city. People believe what they think, not even what they see, but what they think, perception. And right now, the perception is the city is run amok and has been for the last 11 years.
Walk on 8th Avenue. I went to 43rd Street and 8th last night. I literally had to run because I was scared to walk.
And every time you walk into a drugstore, every time you walk into a CVS and see the locked cabinets, it reminds you about the crime in the city. Even though Mayor Adams says that shootings are down, that's wonderful, but, crime is not down.
They're burning people in Times Square.
Right. It's time for somebody to take the reins. And the only person that I can see, for better or worse, even with all his flaws, is former Governor Cuomo.
Wow. Why?
Because he has, in his time in politics, actually shown leadership. I haven't always agreed with his decisions, clearly, as I've stated, and I think it's time for him to apologize for some of the things that he did. And it's not a bad thing to apologize. It's okay to say I made a mistake. I think he's made a mistake with bail reform. He's double talking about whether judges have the right to change bail reform. You have to come out and make a statement. This is what I'm going to do if I'm elected.
But you think he'll be the best leader to take back our city?
As far as leadership is concerned, yes, absolutely. I think no question. I think the other candidates really are lacking.
So, Jeff, if I had Andrew Cuomo back here on the show, which I think he'll come back, how would you ask him, if you were me, these questions? Because there were some things, there were some great things, but there's so much gray area that people are concerned about. What would you suggest he says to people?
I think there are two hot-button issues that he has to address, and address very clearly and very succinctly.
And before you answer the question, I would like everybody to know that you are supporting him.
I am 100%.
So this has been, you're saying this with all good intentions.
Because I want him to win.
Okay.
Right? He has two issues that are hanging out there. One is the nursing homes, which I addressed, and the other is cash-free bail. All right? The nursing homes are simple. All he has to do is say, I made a mistake. I misread what I should have been more careful about. All right? And we will be more careful in the future when it comes to people's lives. He can say it any way he wants, but he has to say, I made a mistake. We will do it better. The second issue is cash-free bail, which I'm sure they had every good intent in not keeping poor people in jail. And that was admirable. The problem is it was overdone. The pendulum swung too far to the left. You have to give the judges some real clout in deciding whether an individual with a knife in his hand in a drugstore can walk out of jail. That person is a danger. If you're willing to, you don't have to kill somebody to prove that you could. Right?
So how would he take that back?
No, we went too far. It's as simple as that. They did go too far. He knows they went too far. He's a very smart man.
So you're suggesting he just says that and says what his new plan is to make it right.
And he must say that if judges start playing games with this, that he will go after them and expose them as not protecting the public, which is really the job of each and every one of these people.
Got it. I'll make sure to pass on the message. Hopefully he'll listen to this. So thank you again.
My pleasure.